So like 60% of the time, I would say na yung workload medyo heavy.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hello po, my name is Darren Cabrera. I originally came from La Union in the Philippines, and I'm currently working as a deputy charge nurse, a band 6 here in the United Kingdom, specifically here in the Southwest. So I've been here for almost 2 years and 9 months, and I've been enjoying my job since I started. I specifically work in trauma and orthopedics, where we get to have patients with fractures, spinal patients as well. Just wanna put out the disclaimer out there that the different working conditions in different trusts are kind of individual and unique, so it may be different from some other trusts as well, or some other wards as well.
Man knows best.
We've got some people to help you with the tasks at hand, and you've all got your responsibilities to do. You've got staff as well. Although there will be times that you will be understaffed, but they do their best. Our managers do their best to make sure that we get the nurse-patient ratio that is ideal for a ward, considering the number of beds and the acuity of the patients that you have.
Man knows best.
But in general, I think the workload in my ward is kind of intermittent sometimes. Sometimes it's heavy, sometimes it's not, but it's manageable. Manual handling is very important, and it kinds of determines how your day would progress, how you allocate jobs, how your day would turn out, about determining how much help they need. Pero sa trauma and orthopedics po talagang mabigat kasi hindi sila makalakad, hindi sila maka-move sa bed. Even turning to their signs, may aabotin lang sa table, talagang medyo in pain sila lagi because of the fractures that they have. So like 60% of the time, I would say na yung workload medyo heavy. Kumbaga, you'd be blessed enough if you receive patients who are mostly independent and requiring minimal assistance.
Man knows best.
In all wards in the trusts, you have different bed capacities. So in my unit, we have 19 beds. That's a mixture of cubicles and beds inside bays. So we make sure that in a long day shift or in a night shift per se, we observe the one nurse to at least 6 to 8 patients. That is the ideal one. So in a long day shift, for example, in a 19-bed unit like my unit, meron kaming at least 3 nurses in a shift sa long day. And then sa night naman, meron kaming at least 2 nurses, kasi sa night shift naman medyo busy siya, but then the acuity is lesser kasi usually mga patients naman natin tulog. Then even if you don't get the staff establishment and the patient ratio na ideal, marami naman po tayo mga other colleagues such as healthcare assistants. So sa long day shift namin, we do have at least 4 to 5 healthcare assistants to help us with daily jobs and routines. And sa night shift naman, meron kaming allocated na 3 healthcare assistants. So hindi ka mag-isa. Some Filipino nurses might fear, it might be daunting for them siguro to start working in the NHS kasi isipin nila na baka mag-isa sila, kasi sa Pilipinas sanay naman tayo sa workload na talagang we take care of as much as 15 to 20 patients at dalawa lang tayo na nurse. Pero dito sa NHS, working in the wards, you will feel supported kasi you will be given colleagues and other staff to help you with all the jobs that you need to perform.
Manong knows best.
Human and material resources are generally adequate. Kasi when you work in a place where you have almost everything that you need materials wise, from ward stocks to medications, to computers, documents, and all the things that you need to perform your job well, nasa ward naman siya, and they never leave it unstocked. So meron taga-monitor ng stock levels natin, may pharmacy na nagmo-monitor ng medications. So basically, ang sarap magtrabaho sa isang ward na kompleto lahat. We adopt almost the same systems nationally. For example, we use a nutritional assessment system called MUST, yung mga VIP scores natin, early warning systems, resuscitation guidelines, from sepsis to AKI recognition, safeguarding, mental capacity assessment. So iisa siya. We observe the same kind of system. So the thing is, even if one nurse would choose to go to another trust, essentially the same pa rin yung ifa-follow mo na guidelines. Kumbaga iba-iba man yung mga SOPs natin, yung mga documentations natin, I'm pretty sure we follow the same rule, we follow the same guidelines. So para siyang comparable sa pansit. So marami tayong different kinds of pansit. We have diverse ways on how to cook them, but essentially pansit pa rin siya. Your managers and the trust will basically monitor your professional growth and development, and will give you a lot of opportunities to advance. So working in an NHS ward, I feel like my capabilities have been maximized. Nabigyan ako ng opportunities to advance. So I started as a band 5, of course a band 4. And then when I got my NMC registration, I became a band 5. And then after a couple of months, I was given the opportunity to become a band 6. And they monitor all my trainings. Binibigyan ako ng opportunities to even go outside the trust to, further enhance my skills, enhance my knowledge. So sa NHS, marami tayong work opportunities. If you want to advance clinically, you have specialties in different fields, from tissue viability, diabetes nursing. If you want to become an advanced nurse practitioner or a clinical nurse specialist, mga CNS natin, mabibigyan ka ng chance, and it's fair. Also, if you want to progress in the management track, pwede kang maging deputy or pwede kang maging ward lead in the future, mga charge nurses natin or mga ward sisters natin. And the best thing is, it's open to everyone. It's just up to you if you want to apply. We work 11.5 or 11 and a half hours to 12 hours per shift, depending on probably siguro sa area mo, kasi may mga area din naman na lesser yung hours na tinatrabaho nila. But since majority of the NHS wards, mga 11 and a half to 12 hour shifts, so most regular RNs are working like 37.5 hours a week, which will give them at least more days off, at least 3 to 4 days off a week. It's run by a multidisciplinary team. So there are nurses working there, there are healthcare assistants, meron tayong mga pharmacy employees to monitor our stock levels, assess patients clinically, magbibigay ng mga stock sa ward natin. May mga doctors tayo na nagre-request ng mga diagnostics para sa atin, and then they will follow it up. We have volunteers to help in the feeding of patients. We have discharge coordinators to help make sure that we discharge patients safely, and 99% of the time talagang hati-hati yung trabaho natin. And the good thing is we nurses don't do everything, but you are valued and heard. If you have concerns, if you have things that you want to say, medyo mahirap na yung trabaho mo, or medyo depressed ka or anxious ka, if you wanna point out an error, if you wanna be a whistleblower, meron kang mga lalapitan na agencies sa hospital natin. And I think one of the best things is that we have like BAME networks, yung Black, Asian, Minority, and ethnic or ethnicity networks natin na pwede nating lapitan if you feel like there's an issue about racism, if you are not given the opportunities kasi under ka ng minority or dahil Asian ka, treat patients equally. So some patients are homeless, some patients are relatives of businessmen, businesswomen here in the UK. May mga taong may mga posisyon, but essentially if they get admitted in the ward, they will stay in the same room, in the same bay. They're given the same materials, they're given the same food, and they're given the same brand of painkillers. So I think one of the highlights is yung trato natin sa pasyente na equal.
Manong knows best.
Rin sa tao yan kung paano niya ibubuhat yung sarili niya pag nang ibang bansa siya, especially dito sa United Kingdom, where the culture is really different. Mapa-hospital man, mapa-society man, food, practices. But number one is do not fear. They may feel daunted, they may feel afraid to venture outside the country. Pero, they will have all the necessary guidance that they will receive dito sa ward. If they start working under the NHS, they will be given a supernumerary status na hindi sila kabilang dun sa numbers so that they can shadow the senior nurses, they can learn their ward routines. Hindi naman sila isasabak agad-agad kasi alam naman nila yung disadvantage nun. And they will be trained to do what is expected of them in the future. So that's number one. Number two is because we are kind of foreigners here, iba yung kultura natin sa kanila. We should, make an effort to learn their culture by heart because, the best thing that you can do actually to lighten your workload a bit in as far as dealing with patients go is here in the United Kingdom kasi ang lahat naman ng mga pasyente natin iba-iba ng lahi, is to at least make an effort to learn their culture. Ano ba yung usual na mga gusto nila, paano ba sila napapatahan, or how would you address them? What would be the difference between dealing with a child, an adult, a demented patient, a patient in pain, na iba sa kultura natin. So I think that's one of the things that they should always remember since dayuhan po tayo dito. So kilalanin po natin yung mga pasyente natin at yung mga preferences nila, ano yung mga ginagawa nila araw-araw. Another one is to be adaptive and try to meet halfway, because in the NHS we are a team na mostly hindi lang po lahat Pinoy, hindi po lahat British, marami din pong ibang lahi, and of course iba-iba tayo ng practices. Hindi naman po natin pwedeng i-push kung ano yung gusto natin kasi dahil lang sa nakagisna natin sa Pilipinas. So, we meet halfway. You contribute something but at least you also acknowledge what they can tell you, what you can learn from them. And that's it. Don't settle for less. Dream big. If you want to go far in your profession here in the United Kingdom, ipakita mo sa kanila na kaya mo, wag matatakot. If you want to progress higher than a band 5, then you may do so, because in essence basically ang hirap naman na parang kung ano tayo dito nung nakarating tayo ng UK, gano'n na lang tayo hanggang pagtanda. So it's good to at least want to develop yourself. And if you want to raise concerns, if you feel like you've been left out, if you feel any kind of racism, you need to speak up. If you feel like unfair yung mga schedules natin or may mga problema tayo sa mga colleagues natin, may mga malalapitan po tayo, especially our line managers and other agencies in the hospital as well, especially yung sinabi ko kanina yung BAME networks. And second to the last, observe proper work-life balance. Ang hirap naman po na magtrabaho lang tayo na magtrabaho kasi alam ko we came here to find greener pastures. We all have the opportunity to earn as much as we can. But then at the end of the day, wala po tayo sa mga comfort zones natin sa Pilipinas. We don't eat the food that we like. We don't get to be with our families that will comfort us in times of distresses. So if you have a day off, then spend it as much as you can. Mag-relax ka din, take all your breaks where you're in shifts. And lastly, I think this is the most important one, is to learn to love what you do. Because, despite of all the obstacles, despite all the stresses, kung mahal mo yung trabaho mo, it will, make it a lot more comfortable to you to go to your work every day. Wala kang iisipin, may peace of mind ka kasi nga mahal mo yung trabaho mo.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.